And if it wasn't clear, yes, I am definitely happy for of doing the fellowship. If I didn't answer that last point.
You definitely did, Shalom. You did.
Okay, good.
Hello, everyone. My name is Miranda Kennedy, and welcome to the Young Physicians Network Guide to Doing Medical School. I am a third-year medical student at Kansas City University, Kansas City, and today I will be hosting a roundtable discussion all about fellowships. Although I am just starting clinical rotations here in Kansas City, this will be my fourth year of medical school because I just completed my clinical anatomy fellowship. Two of my med school besties will be joining me today also to talk about all things related to fellowships because they too were accepted into fellowship programs at KCU. Meg and Stacy completed the clinical anatomy fellowship with me this past year between our second and third years of medical school, and Shalom Lee just started her OMM fellowship after completing her third year required clinical rotations. All three of us will bring to you unique perspectives that led us down the path of pursuing fellowships. And we will discuss the benefits and drawbacks of a fellowship year, how to get started with research projects, keeping up on your clinical skills, how we grew personally and professionally throughout our fellowships, as well as recommendations for those thinking about applying to fellowships. To give you some additional background, there are 3 typical fellowships osteopathic medical students can apply to at osteopathic medical schools, including anatomy, OMM, or osteopathic manipulative movement fellowships, and simulation fellowships. These are typically completed between either year 2 and 3 or year 3 and 4. We're going to focus on anatomy and OMM fellowships today. KCU does not have a simulation fellowship, but I have had friends from other DO schools who have been simulation fellows and absolutely loved it and had only good things to say about them. Without any further ado, let's dive into today's episode. Hi, everyone. Thanks for joining us. If you could introduce yourselves and just give our listeners a little bit of background, that would be great. If you want to go first, Megan.
Hey, everyone. My name is Megan Stacy. I'm a third-year medical student at Kansas City University. I did our fellowship in clinical anatomy between my second and third years. I'm very interested in emergency medicine, and I just moved to Denver to do my rotations.
And Shalom.
Hi, everyone. I'm Shalom Lee. I'm currently between my third and fourth year medical school at Kansas City University as well. I'm in between my third and fourth year because I'm doing the OMM Fellowship this year. I'm interested in urban family medicine, emphasizing with peds, and also planning on using OMM in my practice in the future.
Okay, awesome. And also, just as a quick disclaimer, this is no way affiliated with Kansas City University. This is all our own opinions and our viewpoints, but we're excited to share that with you in case any of you guys want to do a fellowship in the future. So let's just start off with why you wanted to apply for the fellowship and why you chose to take this. Whoever wants to go first.
I can jump in. So I wanted to do the fellowship in anatomy for a couple of reasons. I was an undergrad during COVID times, and so a lot of research opportunities were canceled or became really limited. So I didn't have any research experience coming into medical school. So through the anatomy fellowship, I was able to do several research projects and, sort of round out that side of my CV. I also really wanted a good second pass through anatomy. Although I don't plan on doing surgery, I really like procedures, and I know that I'll be doing a lot of procedures in the emergency room. And I just have this desire to be able to think a little more 3D about what's going on in my patient's body, especially in the setting of like a complex trauma patient. And then I'm also strongly considering a fellowship in wilderness medicine and doing, sort of like remote search and rescue type care, where I won't have imaging and a lot of these other things at my disposal when I'm caring for trauma patients. So I just wanted a really good second pass through anatomy so that I could be caring for people pre-hospital well.
That's really cool.
And Shalom. Yeah, it is cool.
Yeah, so I was going back and forth on whether I wanted to do the fellowship or not. I didn't want to add more years to my schooling because I had already done a master's before coming to KCU. But one, if we're going to be honest, I needed a break between finishing and starting residency. First and second year definitely was not easy for me. So I wanted that break, but two, coming into medical school and being a DO school specifically, I liked OMM already. I liked, I'd gone to chiropractors and massage therapists. So like that clicked with me, that manipulation, it made sense to me. And so I wanted a more in-depth training on OMM to make me stronger in using it. I felt like sometimes I would, practice on my family members, and I felt like I was always having to look at slides and not know exactly what to do. And so being in the fellowship, it's definitely allowed me to like hone in my skills and add in different things that we never would have been taught otherwise, because we go a lot more in depth in the fellowship. Other than that, I think it allowed me also more of a teaching role. I've enjoyed teaching. I've done a lot of tutoring and early childhood education in my past. And so I knew in the future that even if I didn't go into academics, I knew I would, take medical students or something. So I wanted to be able to convey medical information, even at, that secondary level education that I might not have if I didn't do the fellowship.
Yeah, I think it's super interesting. I relate to both of you in a lot of ways myself. I never expected or wanted to do a fellowship when I started medical school. It wasn't really something on my radar. But for very similar reasons, I ended up talking to the clinical anatomy fellows at our school around the time when applications were coming out, which for us was around October of our second year. And it kind of clicked for me after one of the conversations that I think that this would really suit my life. At that point in time, I was pregnant. I had my son near the end of my second year in April. And I knew that doing a fellowship year would relieve me a lot of the pressure of becoming a first-time mom. It would give me a little bit of a break, and it would allow me to enhance my residency application with research and unexpectedly with teaching experience. And so I ended up applying because I want to do emergency medicine as well. And I really enjoy procedures. Another pass at anatomy would really strengthen my clinical skills. And, going into my third year, it would give me a little bit of that break without having to do exams for a year. And so that was initially what got me to apply, and it turned out being the best decision I made. It was one of my most enjoyable years of medical school because I had that break and I was able to spend a lot of time with my newborn. So that was really important to me. So let's dive into the next question. What do you think was an unexpected benefit since you have completed your fellowship, Megan? And for you, Shalom, what do you think might be an unexpected benefit? Because you're about a month and a half into yours, so it might be a little bit different than what we think.
I think for me, the biggest unexpected benefit of doing the fellowship was having time to also work on my master's degree. Our university has some partnerships for dual degree programs. And so I'm doing our dual degree in public health. And so I had a lot more flexible time than I did first and second year. And I was able to get a ton of work done on the master's degree and take extra classes so that it'll really lessen my burden third and fourth year.
Me and Megan did our fellowship at the same time, and a lot of our peers were doing master's degrees as well. I think that if they were on here, they'd probably agree with your sentiment. But what about you, Shalom?
I don't know if it's necessarily unexpected, but it kind of worked out pretty well. I'm getting married in September, so it's nice to be able to focus on that instead of focusing on studying every day and bringing my A game every day. Like, of course, every day I bring the best of me, but when you're on audition rotations, you always have to be on. And I think that it's allowed me to have, I mean, it wasn't unexpected. That's what I wanted. I wanted a break, but it's also allowed me to plan my 2 weddings, and because it's a weekend long wedding. So it's allowed me to plan my wedding and use this time that I needed to do different things and just give me more flexibility. Also, another unexpected benefit is that although it's a OMM fellowship, we are still getting clinical experience, and I'm being able to create stronger relationships with a lot of my professors, and not just the OMM professors specifically, if that makes sense. And so that's been a nice added benefit.
Yeah, I completely agree with that. As I mentioned before, I had my son, and before I took my first set of board exams, and it was really difficult. I did not have a good ending to my pregnancy. I had a very long labor, and my son was actually in the NICU. And so for me, the fellowship allowed me to have a mental reset that I really needed. I'm a non-traditional student, so I started medical school after doing basically 9 years of undergraduate education. And taking every opportunity I could possibly find. And it sacrifices a lot of your time in personal relationships and with your family and stuff. And so after the first 2 years of medical school, which I would argue from a lot of the advice I've been giving is that those are some of the most difficult years of medical school, having that break was just a phenomenal weight off my back. And the benefit that I found was being able to have that time so that when I got into clinical rotations, I could be relaxed and perform well. And also it gave us the opportunity to teach a lot more than I thought we would. And I think that teaching medical students is so much different than teaching in other forms of education, whether that's at the collegiate level or kids. And because we're also smart, medical students will question you to the upteenth degree about something, to the point where you need to look it up because you have no idea. And it makes you so much smarter too. So getting that experience with my future peers was a wonderful way to help me realize that I do want to be involved in education throughout my career. So that was such a huge positive from this past year. So after talking about positives, what do you guys think was a drawback?
I think for me, the biggest drawback is adding a year to this process. I'm a non-traditional student. I'm 35 years old. So anything that extends my time, I feel very conflicted about it. But ultimately, I am glad that I did the fellowship.
I would say the same. I have been in school my entire life. And right from college, I went to the master's program. And then right from the master's program, I went to the College of Medicine. And so I was starting to burn out before my peers because I haven't had a break. And I remember kind of going back on whether or not I want to do the fellowship because I'm tired. I want to be done with school. And yes, the fellowship is supposed to give me a break, but at the same time, that's just prolonging my schooling. And I was kind of going back and forth on what I even wanted to do or not. And so would OMM even be useful? So what was the point of me doing the fellowship? And I know that sounds crazy because there's so many pros to the fellowship. And honestly, my only con was I want to be done. But I do think that, like Megan said, I am really happy that I did decide to continue doing the fellowship. It's been a great experience so far. I've only been doing it for like about 2 months now, but it's been a great experience. And even though even though it's a break, even though it's like still me working, it is a break, and it's allowing me to, have even stronger letters of rec and even stronger clinical experiences now, and hopefully getting me, keeping me fresh for audition rotations. And hopefully that'll help me for residency and not feeling as burnt out as I could have been.
Yeah, you brought up a good point, Shalom, how it's strengthening, gives you the possibility of strengthened letters of rec for residency. I think that was truly another unexpected benefit was we were able to make very strong relationships with some faculty and staff members that are medical school, because it's a very small group of people when you do a fellowship. And Kansas City University is a really big medical school. And so it allowed us to have closer mentorship relationships that really strengthened throughout the year. And it's really nice to be able to email one of your past professors who became your mentor when you're kind of stuck and you just need some advice. You could really rely on them. So I think that that's a really awesome, unexpected benefit. But as Megan said, drawback was definitely adding that additional year. It was a huge discussion my husband and I had to have. It means more loans. And well, for us, we got a stipend and a year of our medical school paid for, but you always worry about the an additional year of accruing interest. So that was something that we really went back and forth on. And then also because we're interested in emergency medicine, this puts us graduating in the class of 2027 when emergency medicine is meant to change from a 3 to a 4-year residency across the board. So that was a big bummer. But as Megan and Shalom said, I don't have any regrets. I'm really glad that I chose to do this. So for all of the fellowships at Kansas City University, we're required to do a research project or multiple research projects. For students that are maybe new to research and trying to gain more research experience, what do you guys, how was your approach to that? I know that, Shalom, you mentioned to me off the record that you got put on research projects. I know that Megan and I had to pretty much come up with our own. So do you guys want to dive in and talk about how you decided a topic for your research project?
Yeah. So I think I misspoke. I wasn't put on research projects. Like you guys, we got to pick. It was just that I ended up signing up for a lot of research projects. So in the beginning of our fellowship, we start, even though students don't come in until mid to late July, we started July 1st. And so we spent a week or two of orientation. And then towards the end of the orientation, it was figuring out what your research project wants to be. And it doesn't have to do with OMM. And so originally I was trying to do certain OMM projects, but the problem is you have a year to do it and you want to be published. And so realistically, we had to, you have to tweak and change and see what's realistic to you. So one of the research projects I'm in actually has nothing to do with OMM or clinically. It's learning theory and looking at, medical students. And, we do a lot of practice problems, and that's obviously not how they're telling us to learn, but for boards, it's you need to hit this amount of practice problems and it correlates positively. So taking that, and it's is that the end all be all? Is that enough to do well in medical school, or do you need to add content review and recall and things like that? So that's one of them that I'm doing with a co-fellow. And then another one is a second year reached out to me because she's in our summer research program. And so she's doing a systematic review on HPV outcomes. And so I was one of her reviewers. And so having to do a lit review on all of those, and then, going through the JBL checklist and having to score all of these. So that was another one. And then my own research, I'm looking at osteopathic approach to endometriosis and fibromyalgia. These are very big and common conditions that women have, mostly women have. And I feel like there's not a lot that we do with it medically. It's here are the few things that you have for endometriosis, here are the few things that you have for fibro. And unfortunately, most women don't respond very well to the treatment. So like so this one is more geared towards OMM. So like looking at different osteopathic treatments and seeing like what would any of these potentially help that condition? And if so, this is how you do the technique, and this is what it would be for, because we have a lot of studies with OMM and it says, oh, OMM works, but then they don't tell you how to do it. So is it really that helpful? So basically that, and then one of our professors is doing a research project as well. And I said I would help with that. So mostly just me getting myself into multiple research projects by accident. But yeah, we were able to kind of decide what we liked, but then also having to be realistic on what can we plausibly get done in a year.
Yeah, you're going to be busy this year, Shalom.
But one more thing I wanted to add, and then Megan, it's all yours. Megan came in saying like, oh, I wanted research. I came in with medical school with no research, and I wanted to leave medical school with no research. So the fact that I want all these research projects is crazy to me.
Yeah, I had no direction or like formal ideas about what kind of research I wanted to do. I just knew that I wanted to do something and kind of fill in that gap on my CV. So advice that I was given and what ultimately ended up working out for me is I just went on some of our like library websites and databases and just started searching topics that I found interesting. And I would, click on one article, read it, click on the next one, click on a related article until I found a topic that was actually very interesting to me and needed more research done and like clearly had next steps that could be followed. So that would be my advice to someone if they weren't quite sure what kind of research they were interested in, is to just find something that is very interesting to you and that has clear next steps that you can follow. I think a topic being very interesting you inherently will just show through in how you approach the project and how you're able to speak about it later. And from speaking with different residency programs and at networking events, being able to speak very passionately about a research project seems much more important to them than how many projects you've done total. They'd rather see you do a few that you were like heavily involved in. So that's what I did.
Yeah, I'm going to echo what you guys both said. Megan kind of outlined it, and Shalom, I think, subliminally said it. But do something you're passionate about. And I think it's a lot of people say that, and you're like, I don't know what I'm passionate about. I'm so busy. It's really hard to come up with ideas when maybe research is not something you've been involved in before, and you really need mentorship. It's hard to find a mentor. There's like a lot of steps of it that can make it challenging. I think Megan laid out a really good recipe with getting started. I think it also helps when you talk to your peers that are maybe a year or two ahead of you and asking what they did and asking if there's a project that you could be a part of. If you're involved in national leadership, there's, several different osteopathic organizations that are involved with research that would love students. So that's one way to go about it. Our fellowship required us to do an anatomical project. And a lot of students use the anatomy fellowship as basically a research year so that they can get a lot of poster presentations done and publications is to beef up their residency application, especially for these more competitive residencies that expect to see a lot of research and expect you to understand how to conduct research. For me, clinical research has always just been more attractive to me than bench research. Bench research is honestly boring to me. I don't like it. And doing research when you're coming up with your own project with limited funds at an osteopathic school can be sort of challenging depending on where you're at. A lot of people try to give you a recipe for it. that is really just unique to them and is hard to generalize. So I think the first step really is finding a good mentor. In our fellowship, we were not assigned mentors. We just had to ask people in our department, which I didn't have difficulty with. Everyone really wants to work with you. They understand where you're at. It's just coming up with the idea. And so I did a lot of what Megan did. I searched through articles that interested me and tried to come up with an idea that way. My project was a little bit, I tried to incorporate some clinical correlations within it, which is what you should do. And then I ended up doing a survey project, and I did another project that Megan came up with a wonderful idea of reaching out to the coroner's office in Kansas City and using some data with them. So it all worked out. I ended up doing about 3 projects. I'm still working on them publication-wise and going to present at OMED. But really, when it comes to this, you gotta be outgoing and try to make those connections to find that mentorship for these research projects. And really, for me, it didn't happen until the last half of the year, which was okay. We also had to present our anatomical research project at a national anatomy conference. So that was a lot of fun and gave us really good experience. It's something I hadn't done before, so I really enjoyed that.
You're listening to YPN's Guide to DOing Medical School. This podcast is hosted by the Young Physicians Network of MAOPS, the Missouri Association of Osteopathic Physicians and Surgeons. MAOPS has been the voice of osteopathic physicians in Missouri for the past 125 years, advocating for the osteopathic profession at the local, state, and federal levels. This podcast is created for students, by students, to help with the unique struggles of medical school, tailored to the osteopathic experience. Have a topic that you would like to hear about next season? Let us know at our social media pages, Instagram @DO_MAOPS, and Facebook at Missouri Association of Osteopathic Physicians and Surgeons. This is YPN's Guide to DOing Medical School.
As far as keeping up on clinical skills, I think that's a huge worry that a lot of students have when going into the anatomy fellowship specifically, especially before we start clinical rotations. So would you guys be able to touch up on what your plan is for keeping up with clinical skills or what you did?
Yeah, so I was definitely worried about that. I didn't want to go into third year having forgotten a lot. So luckily, our school has a student-run clinic option. And so I was able to go usually about twice a month and work a shift at the student-run clinic, which is a primary care clinic, but we serve a very underserved population in Kansas City, a lot of homeless people. So they had pretty complex medical problems, and it was, fairly challenging and challenged me to think and remember, some more unusual diagnoses or medications. And so I was very grateful for that opportunity.
The OMM Fellowship is between your 3rd and 4th year, and then the anatomy fellowship, at least for now, I think they're trying to change it, is between your 2nd and 3rd year, at least for KCU. So I was able to have my 3rd year, and they do that because the OMM fellows help with our class is called ECO. So it's like, the OMM plus the doctoring classes. And so we had to be able to know the clinical stuff to be able to help our students. So I had the 3rd year clinical experience, but then also a few of our faculty do still work in clinic a few days of the week. So right now we are required to do clinic with 2 of our professors, actually. So some weeks it's just Mondays, and some weeks it's Wednesdays, Fridays. And then another one of our faculty has let us know that if we're interested in shadowing with him for his clinic, that's also available to us. And two of those clinics are very urban, underserved clinics. And then the other one is more like an ortho clinic in Overland Park. So very different patient populations and different, even though they're all family, well, two of them are family med, it's definitely different clinical experiences. So that's really nice to be able to see. And we'll be doing that all year. So that definitely allows us to keep our clinical skills up.
Yeah, I think the OMM Fellowship and the Anatomy Fellowship are very different in terms of your responsibilities, even though you're interfacing with students. As Megan said, I was involved with our student-run clinic as well. I actually went every day that Megan went. We were both EMTs before we started medical school, but Megan has a significant more amount of experience than I do. And so I was able to lean on her to help not only keep up on my clinical skills, but improve them. So it was really nice to be able to rely on one of my really good friends and peers to help myself keep some of those skills that I learned my first 2 years and build upon them. And just as a little caveat, right now the Anatomy Fellowship at Kansas City University can be done between your second and third year or between your third and fourth. I think the fellows this year, the majority of them have completed their third year. It's just a little bit different as far as the responsibilities, and that's why there's that flexibility. But yeah, I don't feel like I'm at a deficit by any means starting rotations now. I think that little bit of experience helped. And honestly, it just comes back to you. You work hard your first 2 years and you'll be okay for that third year for sure. Moving on, can you see any personal and professional growth retrospectively, Megan? And I know this is a bit of a tougher question for you, Shalom, but how do you expect to grow over this next year in preparation for your last year of medical school?
Let's see. As far as personal growth through the fellowship, I think this year taught me a lot of patience. And I'm not saying that to be cheeky, but you get so many students coming to you for advice, and they're very anxious. Some of them coming to you with personal problems and just looking for a shoulder to cry on sometimes. And I think I'm a pretty patient person anyways, but there were definitely days where I wasn't necessarily in the mood or whatever. And personally, I think I worked on my patience and empathy a lot more this year because it was very easy for me to reflect on how anxious I was first and second year and how much I needed my upperclassmen to support me. So, and I think that carries forward professionally as well. In residency, when we have our own medical students working with us, being able to extend them that same level of patience and grace when they might need it. Professionally, I think the thing that I worked on the most this year was teaching. And teaching is hard. And I did not give our professors, enough credit, I think, first and second year or an undergrad, because for our anatomy fellowship, we had to create all of our own teaching and tutoring materials for the section of students that we were assigned to. And so figuring out how I wanted to teach, what my teaching style would be, how I wanted to organize topics and break up teaching them, just all of those logistics to being an effective teacher. It was so much harder than I thought it would be, but I'm also really glad that I figured out my teaching style and how I would do that in the future, especially if I wind up at an academic residency where I may be in a bit more of a teaching role. I think professionally, getting all of this teaching experience will serve me well in the future.
Yeah, I definitely agree on the patience thing. So I know it's only been 2 months, but I definitely see the development, and if not the potential for development, both professionally and personally. so professionally. We have our first and our second years back on campus, and we've had multiple labs with them already. So it's been really fun teaching, like kind of like what Megan was saying, like it's hard and, it, like it clicks with you, but that doesn't necessarily mean the way you explain it or the way you understand it will click with someone else. So like trying to explain to them how it clicks with you. And then if that doesn't work, having to, step back and be like, okay, what is another way I can explain this to this person for them to understand? And then because it's like so hands-on, having to, hone in my skills to help them like physically feel things is it's cool. And it's exciting when they have like that, like their eyes get big and they go, oh, like, I love that. I love the teaching part. And like, I've always loved teaching, but I didn't think it would be like already so rewarding within like literally the first month of people being on campus. So that's been really exciting. I've really loved, helping them through lab and like teaching them. But definitely there's a patience thing because sometimes it's like, and, I have to give them grace because I'm sure I did this as first and second year, but like for our second years and we were doing like physical exams and I'm like, how do you guys not remember this? Like, come on, stop looking at the iPad and just do it. But like giving them grace that like, it's summer, they went and forgot, it's okay. And then also like teaching them like, stacking, like, yeah, we did a cardio exam. Like you think, oh, I'm supposed to do my cardio exam and then do my my pulmonary exam, and then trying to tell them, no, you can mix things up. Like if it's all on the chest, do all of the chest, and then kind of like having to like almost fight them to make them understand, like, no, you stop looking at the rubric and just trust yourself. And the same thing for OMM as well. Like it's been like, especially personally, like it's been so rewarding because you go by the rules, like you go by how your school teaches you. And then with the fellowship, they were like, throw all of that out. Like, because like, obviously the rules are there as guidance, but then every body is different. So like, just because, so like these atypical things, like, with the Friet's principles, like saying like, oh, you can't have a group of type 1s when that is not true. Like you can. And so like when people find that in lab and they're like, oh, I must have done something wrong, and having to explain to them, no, actually, you did it right. And you trusted your hands. It's just not what the slides are saying. And so like trying to have a balance of that. And then like the amount of things I've already learned during the fellowship that is like astronomically like higher skill level than the 2 years of medical school has been crazy. Like continuously being able to like talk with my professors and learning new techniques and new like ways of thinking and like new, like you can combine techniques and like they just make things up, like not make things up as in like it's fake, but like you just go by what your hands feel and like what that body needs. And like, it's like combining two different techniques. It's crazy. And I love it. And then when we do it in like fellows practice session and I'm like showing a student and they're like, what is this? What just happened? And I'm like, yeah, do you see it too? So like, I love it. I love like the teaching. I love the OMM, and I love that my skills are already being like tested and they're already growing so much, and that there's so much more I can do with it. It's really exciting. And I've already had a really good time with it, as you guys can tell with me getting, louder and talking faster. They know this is my true personality.
Oh yeah. I agree with both of you guys. My personal development was a little bit different. I think that I've always struggled with my confidence. I wouldn't consider it imposter syndrome. I never felt like I didn't belong in medical school. I always knew that I deserved to be there and yada, yada, yada. But I am very doubtful of my actions, even when I'm correct. And, I think that was really exhibited in a certain experience actually near the end of my fellowship. For the anatomy fellowship, we're also in the honors surgical track at KCU. And we were doing a demo with a surgeon, and it was about inguinal hernias. And I, of course, they asked the first question. And even though we had just reviewed it and done a quiz on it, literal word vomit came out of my mouth. It was a horrible experience, not necessarily because of the trauma surgeon. It was more because I was so unconfident in what I was doing, and I should have known it. And, retrospectively, I'm so glad that happened at that time, because my first rotation was in surgery, and I got asked that question the first day, and I got it right. And it allowed me to really reflect on what was making me unconfident. I think a huge part of it was being there, and I never babysat before, and I come from a family I have an older brother, but I was the youngest. So kind of going through motherhood didn't really help with my confidence necessarily. But it allowed me to kind of look at what I was doing, and I was in a role where I was a teacher too. So had to work on that confidence and say things that were correct with confidence. And I think that year allowed me to relax a little bit, reflect on that, and improve. And ultimately, it allowed me to go into clinical rotations, being more sure of myself and saying things with confidence. Because when you're working with patients, you don't want to say things hesitantly. It makes them doubt you, and it makes you doubt yourself. And nobody really wants that in a provider. So that was a huge weakness of mine that I was able to work through, and improve. Still improving, but it got better for sure. And as far as the professional growth I had, I really agree with Megan and Shalom. Teaching is difficult. It's difficult to approach it from multiple viewpoints. Having a broad perspective when you're planning out how you want to teach others, I think, is really important, because not everyone learns the same way. And being in the hot seat with medical students who are super, super smart, asking you all these questions, puts a lot of pressure on you, because you want to give them all the correct answers. And the truth is, we just don't always know everything. So not being afraid to look it up and just saying, hey, I'm going to get back with you on that, and asking one of the anatomists at our school was something that I had to do frequently. And it really opened my eyes this past year to how many people in medical school still struggle with anatomy. I don't have a problem thinking in 3D. Organic chemistry wasn't as difficult for me as general chemistry was. I kind of related to that. So in my mind's eye, knowing we're different stuff in the body, it just made sense, but it doesn't for everyone. And so this really opened my eyes to that struggle, and helping students through that and think about things differently and test-taking strategies was a lot of fun, and also allowed me to build a good foundation so that I can maybe teach patients better, and I can be involved in academic medicine if I would like to later in my career. Teaching is a lot of fun. It's very rewarding. And like I said at the beginning of this episode, it was a huge positive this past year, was learning how to be a better teacher and giving our professors grace in the times that maybe we were a little bit more judgmental. But well, for our last question today, what would you guys recommend to students interested in fellowships? And would you recommend doing a fellowship year after everything that we've summarized?
I think what I would recommend is, if you are interested in doing a fellowship, definitely go speak with your current fellows or anyone else you know that has done that fellowship, and just really understand what it's going to entail, the amount of time, that you're going to be putting forth each week, and just make sure it aligns with what you want out of the fellowship and what your goals are. Because the last thing I would want, for anyone, is to wind up in a fellowship year and then just be very unhappy with it. So yeah, I think go talk to people and just really understand what you'd be getting yourself into. And then overall, I strongly recommend doing a fellowship if it aligns with your goals. For me, it aligned with my goals of, largely getting some research experience. And so I'm very happy with my decision.
I definitely agree with Megan. If the fellowships that are offered, you're not interested in them, don't do them. If like, for example, Megan wanted that for research. If you know you did not like anatomy and you did not like, and you don't need research, or like you're going into a less competitive specialty, or you have a lot of research on, it doesn't make sense necessarily for you to do it if you're not passionate about that. And same thing for the OMM Fellowship. I feel like you have to like OMM. You have to be passionate about that, or it's not going to be a great experience for you. Like, yes, it's going to be great for teaching, but if you don't like those things, I don't think it would be that great of an experience. Like, for example, someone else in our friend group actually was supposed to be in the OMM Fellowship with me, and she realized, like, one, she doesn't like OMM that much, and two, like, she doesn't really like, it didn't align, the fellowship and what it would do, didn't align with what she wanted to go into, for example, because she wanted to go into EM. So it really didn't make sense for her to do the fellowship. Like, I want to go into family med, and some other people want to go into PM&R, and some other people want to go into sports med. And someone else did want to go into EM, but he knows he wanted to use family med. I mean, he wanted to use OMM. So it needs to align with your goals. Yeah. Or like, you're not going to enjoy it, and it's going to be miserable for you. And then now you've pushed yourself back and you're not graduating with your class. And it's funny because all of us somehow just all ended up, being either in a fellowship or just something else happened to where, like, now we're all graduating together. For the most part, all of us in that friend group are graduating together. So that's funny, but it's not always like that. So like, you have to make sure it makes sense for what you want to do. Because at one point I was interested in inpatient peds, and I was like, I don't think I'd be able to use OMM in inpatient peds. And I was wrong, but like, either way, that's what I thought. And so I was like, well, it doesn't make sense for me to do the fellowship then. So I think, like, basically, to wrap this up, like what Megan said, it has to align with what you want to do. And then I think, yes, it's going to be a great experience. I was going back and forth on whether or not I wanted to do it, because I just wanted to be done with school. But it's ended up being a great experience. And I am getting, like, yes, we're busy in there from 8 to 5, but after my 5, I don't have to study. I get to go home. I get to hang out with my friends. I get to plan my wedding. And it's just, and when I need certain things off, I let my faculty know, and I come in late or I leave early for those, like for an appointment or something. So it worked out for me because I just have a lot of things going on this year to where I needed that flexibility that I may not have gotten during 4th year.
Yeah, I think bottom line is just do what you're passionate about. It's so much easier said than done. And I think that both Megan and Shalom brought up excellent points. I would definitely recommend doing a fellowship year to medical students that feel like it would improve their education. Don't do something you're not passionate about. There's so many opportunities in medical school. You can achieve your goals a variety of ways. For me, fellowship was absolutely the right pathway. I have no regrets. And so far, it was my favorite year of medical school. So 100% go for it if that's what you're passionate about. But you know what? If you do go for it and you don't get it, it's not the end of the world. Things happen for a reason, and there will be other opportunities that come your way. Just keep trying and do things that you love. And that'll really show when you apply to residency, and it'll make you a happier person. Medical education, undergraduate and graduate, it can be a miserable experience if you aren't doing things that you love inside of the educational sphere and personally. So find ways to make yourself happy. And for you, if that's taking a break and getting a teaching experience and research experience under your belt, then do it. Thank you guys so much for joining me today. I hope that all of our listeners find our advice and opinions about fellowships valuable. And thank you for listening.